Here's a CT of the abdomen and pelvis that was performed, and incidentally noted within the renal sinus, you can see that there's a large amount of fatty tissue with maybe some wispy soft tissue components to it. We can see that this kind of also indents the normal surface of the kidney itself, so there's some kind of mass effect from these prominent areas of fat within the renal sinus. You can see that here. Here's the ureter coming out, and then on the left you can see the ureter coming out. Similar appearance, it's flattening the kidney here, and so there's a differential for this. One of the things you think about is renal sinus lipomatosis. Renal sinus lipomatosis is a benign proliferation of fat in the renal sinuses that spares the renal parenchyma. You could also get renal replacement lipomatosis, which is a more advanced form of renal sinus lipomatosis, where the fat actually replaces the renal parenchyma. And then other things to think about is, could this be perirenal liposarcoma, which is a fat-containing tumor? So that's in the differential diagnosis. And then finally, another thing we could think of is fatty tumors involving the kidney would be an angiomyolipoma. This does not look like an angiomyolipoma. This is involving the renal sinus, and it doesn't really have too much soft tissue component. So this is really a case here. This was ended up being biopsied just to make sure that this is not a liposarcoma, which would be unusual given the fact that it's bilateral. But one of the tests you can run on a biopsy is something called MDM2, which allows one to be able to differentiate a low-grade liposarcoma from just fatty tissue. This patient was biopsied and ended up being benign fatty tissue, and so this is probably a patient who has renal sinus lipomatosis.